So this is part 4 of June's second workshop on breathing pattern disorder.
So like I said, the assumptions are that you're following all the sanitation stuff and all of that. Okay, so I want to mock up just a little bit of an interview concept that would focus on how I might ask a few questions related to the breathing and a couple of simple assessments. So Luke's come in. He hasn't gotten on the table yet. He's starting to undress before I've left the room. How many times does that happen? He's filled out his history form. He has given me a goal that he has trouble sleeping, which you do. All right, so I'm going to ask a few questions that relate to that questionnaire. All right, so I'm going to just have a conversation with him, and I'm going to say, okay, so sleeping is the major concern, and what do you think is interfering with that?
Mostly it would be that I get locked on my phone. But reading.
You're
tablet.
reading. All right.
Tablet, but there's backlight, so I've learned to use like photo filters and stuff like that.
So your
brain doesn't turn off.
Your brain does not turn off.
Yes.
So is it busy thoughts? Are you okay? Do you have any digestive stuff?
I have recently.
Okay, so
Antibiotics.
constipation or diarrhea?
It's all better now, but I think we're going to take something that potentially in a real situation.
Breathing, if you're running for your life, is what your body thinks it's doing. It's either going to dump the load or it's going to retain the
turn
load.
it into a rock. But that is two components regarding stress and anxiety. It can be that there's like an incontinence kind of component where things are going out more than they should, or there is the constipation piece. You'll tend to, with stress, it's usually more about constipation.
Yeah.
And in the medical arena, if there's pain medication, that can also be enough.
Have you had any kind of a cough or a sniffle or a sneeze going regularly?
Some upper respiratory, let's say it's seasonal allergies.
All right,
Like
so people who sniff a lot, know somebody like that?
Yeah, my grandma.
Yeah, all right. Or they big sighs.
That's
I guess, all right. So I'm watching for this, all right, and then I'm gonna say.
everything's wrong. I should do it wrong.
So I might put a hand on their shoulder while I'm chatting to assess to see if their shoulders are coming up and down. Or I can say, well, let me just feel your shoulders. Oh, all right, so that's awful.
This would oppose to somebody coming in.
All right, and right here too? Okay. So you're using, it appears you're using muscles up here to breathe instead of ones down here. And that can make your blood gases different. That makes you feel like you're dealing with a lot of emergency and the brain won't turn off. And so we're gonna just do a real general type of a thing, and we'll see if you notice any difference. All right, I want to teach you a couple of exercises to do that will prevent you from using these muscles. The first one is just put your hands behind your head. So what that's doing is locking these muscles in so you can't breathe with them. So go ahead and take a deep breath. See how that starts to make you work down there. The other one is to bring them back behind you if you can. If you can't do that, just pushing your hands to the floor. And then that's it, that's the activity, because it'll keep these muscles from being used to breathe. Another thing that's really comfortable is to get a heavy weighted pack and put them on your shoulders. So that's helpful. Okay.
Interestingly, in my personal journey, a lot of that was exaggerated just for assuming you have this client for stuff, right? But I do have a weighted vest that I actually use for exercise, and oddly enough, I got it for exercise, but noticed that it helped me a great deal more with like some shoulder issues I was having. But there was something to it, the kind of the weight here and letting that kind of rest. It was during this, we were editing the new review guide, and I'm not used to being in front of the computer for so long. So I wasn't getting as much of my like exercise and daily activity. So I was trying to figure out a way to make working at the computer a workout. So it was a weighted vest and kind of wiggle around while I'm reading a million questions and stuff like that. But little tricks like that go a long way. My other 2 cents with breathing is for yourself or teaching clients, having them focus on a really good long exhale, hands on belly. Feel like with the exhale, the belly button is going in toward the spine. All air all the way out. The inhale, the recoil will happen a bit more reflexively and naturally. So you can couple that with some of these postural, there's everything from holding a chair and doing that, but that's stabilizing the shoulder girdle. The other piece of this can be focusing, getting all that air out. Then there's room for the air to come in. So,
Chapter 15 in your fundamentals book has got all the stuff in it, in addition to the handout. Okay, so one of the things we're gonna he wants to undress before I leave the room. Since you haven't been here before.
We'll walk you through the whole thing. Okay.
I just want to give you a little preview about what we're going to do. I'm going to do full body massage, but I'm going to target your breathing mechanism, because I think that might be a big player in you not being able to get to sleep. So we're going to use multiple positions. We're going to start you on your tummy, but I'm not going to leave you there very long. I'm going to move you on your side, one side then the other, and then a little bit on your back. This is so I can access the torso. And most people sleep on their side, so it's more comfortable, and laying on your tummy isn't the best for your back and breathing anyway. I've got a pillow under here. You're gonna put your, right below, so your belly button's right in the middle of the pillow, right there. Under the sheet, all right, under the sheet.
Be amazed.
Not that that's ever happened, has it, Karen?
No, that's never happened.
And you wouldn't usually be leaving the bolster in. I know sometimes.
I do or don't, it doesn't matter.
Yeah, but
all right,
you
so
gotta really show them. You hear all that, like walking them through what to expect in terms of the positioning. People will be surprised by a sideline if they've had massage before.
if you tell them right up front, then they're not. And ask Karen about her nightmare with her teenage client, who she didn't explain this stuff well to. And I won't take it any further than that. All right, so I'm just gonna have him take his shirt off, right? Okay, so I've left the room. All right.
Officially left the room.
All right. So instead of putting his shirt on the hanger, he'll put it on the chair, right?
Right.
Because that's what
People would
everybody
assume
does.
such a thing.
Now, this table doesn't have a face cradle, so whatever. All right. I know, I'll get there. This is why I don't teach stripping.
Right. Not like a tangle in their feet.
It's harder when they got clothes on. It's easier if they don't have clothes on. All right, now the assumption is I'm going to do a full body massage. That's the assumption. I'm going to just show you some things on the torso, and that's what you're sort of going to practice. All right, so we're going to start here. All right. So you're going to learn with your assessment that you try to remember to not get the lotion on right away. That's harder to do. So, and one of the things I'm looking for, and he's got pretty good dog skin, Cause I want that skin to slip and slide, so. You know how you can pick up dog skin?
Yeah, Sharpay.
What's that? Especially if they're a Sharpay. So he's not got too much of that idea. Right there he's a little stiff. But I'm getting a sense of what the tissues are like, all right? Then I'm assessing, this is all assessment. I'm gonna do a little bit of this rib springing. So he's a little stiff right there. That's okay, that's okay. You're just the experienced massage therapists in the room have their palpation skills down. The newer students just still working on what that feels like. I'm gonna decide before I even do anything to do an intervention right here. I'm gonna press this down. You're gonna breathe in, breathe all the way out. Inhibitory pressure. Okay, one more time. I'm just holding it down.
But when I exhale, you're following.
Yeah, I'm taking the pressure down on the excess. One more time, and then when you get all the way to the bottom of that breath, can you cough?
Do I need to?
Oh, there, yeah. Okay.
But the nuance there is, as the person exhales, following the ribs in, and then when they inhale, you maintain that pressure and kind of fight the ribs as they come back up.
All right. I'm going to do a general massage of your back, and then there's a strip right through here where I'm going to put a little bit more pressure. Let's see what kind of pressure you like generally. Okay, so tell me when I hit the spot that feels the very best pressure-wise. Right around there. So that's moderate. Now, I did catch some of the students not having their shoes on. When you've got to have your shoes on when you do massage. If you don't, your foot slips. So this foot back here, when I'm doing something like this, that foot's got to stick to the floor. So we're just going to do some general gliding. I wanted to make sure I didn't fall off the edge of the stage. Okay, now I went through that really fast, but you got the idea that just general superficial work in the area.
All without lotion.
Not very much, just a teeny little bit.
Okay, there was some.
A little bit. Okay, so this client had said to me, I really like deep tissue on my back. Okay, so this is where you come in. That's how much lotion yeah. This is the one I showed you. I'm gonna get up a little bit on top of it. Does that feel good?
Mm-hmm.
Would you like more pressure than that?
A little bit.
Okay, you go ahead and push back at me until you find that sweet spot. All right, good. Nice. Would you like a little more pressure right there?
That's pretty good.
That feels pretty good? Okay, it doesn't hurt.
It has that good hurt.
Got a good edge to it.
You gotta try to, for the beginners, there's a lot of potentially having to coach clients do, it should
Yeah.
be just right. They can have an intensity to it, but it shouldn't be so much that it feels like you have to struggle to breathe.
So I
Especially when
wanna,
we're talking about breathing, you should never be causing enough discomfort where it disrupts that. Then you know it's too much.
right, he should be able to talk to it. I'm gonna show you something else nuance wise.
No, that's perfect. I need more than that.
Yeah, that's wrong.
That's too much. I hear it in their voice. They're not breathing right.
Do you see how I just straddled his arm? See that? That's not very good, right? Alright. If this arm were up and tucked under, that wouldn't occur.
So moving their arms just what makes your life easier.
That was me being pretty with a transition. Turn your head this way. That's it. My hand is here so that my breasts are not enveloping him, which they would. Okay. And turn your head the other way. You could also put a towel or something there. I try to keep the clutter down a little bit. So that's my take on it. I just put my hand on his head.
It feels like massage, but sometimes placing your hand or arm in places is a way of making sure you don't make inadvertent contact with the area. If you put your hand on it, you know the rest of your body is gonna not be able to make contact with it. So it's a sneaky way to integrate what feels like massage, but really is built on just modifying so.
Okay, so now I'm just moving those facets. That's all that is, springing those ribs. Done, I'm done with the back. Okay. I am gonna get the best access to rib mobility if I've got you on your side. So we're gonna turn on your side. I'm gonna put a pillow here, you're gonna scooch down.
Which way do you want me? Face that way or face that way?
Face towards the pillow, or the
Here.
mirror. Scooch down, tell them to scooch down. Alright. Otherwise their head's hanging into the face cradle and, you know, then it's just not good. Alright, we're gonna just flip this around on the side. Now this is sticky because we don't have a pillowcase on it. Now, here's the trick for sideline. You see this part of the sheet? This is why I wanted the bigger sheet on the top. This comes underneath their head. It's held tight against the chest right here, so it doesn't slip. That's the only trick to the whole thing. The only other thing I might do is, and I got it twisted up, I might take the bottom sheet and bring it up and over, which would add a little bit more coverage. So this could gap right here.
I personally always would just get clients set up like this and would take a towel and put it over the arm and shoulder.
Yep, that's what I was just getting ready to do. All done. Okay. So anything that can attach to the ribs, muscle-wise, will respond to inhibitory pressure plus movement. Our main movement for breathing disorder is what? Breathing. Novel, right? So when you're going to work in the cervical area, always make sure that the nose is turned towards the table. We don't work on the anterior part of the neck right here. So if you can do, there, get your sternocleidomastoid out, always behind it. Now I can use a loose fist here, or I can do a forearm. doesn't make any difference. I use my forearm whenever I can. And breathe in. And blow it all out nice and slow. See how I exaggerated that exhale? And again. Just showing you a loose fist. Okay, breathe in. Now, everything here also attaches around the shoulder. So inhibitory pressure plus movement could be, can you roll your shoulder? And really slide your arm towards your feet. Remember this activity, this exercise I showed them?
Usually that's what I have to tell people, reach,
Reach
do
for
the
your
roll, do the roll, but reach for the toes.
feet. Good job. Then I'm going to come at it from this angle. And same thing. Still holding the head down. Now, that's forward, watch the legs, back, forward, watch, it's all here, back. Forward, back, forward, back. All right, lift your arm up. Good. Oh, look, it's a back. All right. You wanna just hold that right there, nice and tight. Roll forward for me. Remember Luke talking to you about using the loose fist? So I'm pushing him that way while I'm leaning right into this right here. I'm going to bring this arm up. This is why you want this tight at the front. All right. I'm going to hold this so it doesn't flip forward, right? I'm going to hold that right there. And all I have to do is change my position. So when he's in forward a little bit, I'm working on that latissimus part. My heel is here, but I'm closing the umbrella. Then I'm going to roll him back just a little bit, and I'm going to get to the whole anterior serratus stuff. This is about the scapula. So if I lean into that, go ahead and roll your scapula in a circle. Good. Then I'm just going to squish the whole rib cage into as many different shapes as I can. I'm just showing you this, how you can do this so you don't feel like you're poking somebody. So you can put a blanket, a pillow, something on top of the rib cage. or not. All right, so I'm gonna use a double arm. And I'm just gonna press down on the rib cage and breathe in and out. It's the same premise as what I was doing when they were on their back, or on their tummy. And in and out. Give it a little bit of a push. And in and out. You should hear them go. All right. Once you get to know the client, I wouldn't do it first time out, but once you get to know the client, there are some easier ways on you to do this. Can you scoot yourself to the edge of the table back here? I'm just gonna lean over him. So, all right, so I'm gonna lean over you. And I'm gonna use my body weight to squish your ribs, okay? All right. And I can roll him back and forth a little bit. And done.
I know the application seems awkward, but I swear to you, it's probably, for me, one of the most profound applications, because there is no way to distort the ribs all at once like that, other than that or sitting on a person. And sitting is more awkward.
I think that one's way more awkward.
Yeah, it's a personal preference.
Yeah.
Then my boobs are on you.
Well, right, that's where
Well,
you
I have to make sure they flop over.
It doesn't matter, they're still very there. They're
And that
either
is a
in front of
component.
them or
Yeah.
on top of them.
Yeah.
I sit on the guys.
Yeah. And we'll show you both options. It's just, you do need to get to know the client and be transparent, but boy, getting the whole ribs to shift like that,
Yeah.
it's,
I think the big thing is
nothing
putting
can
a barrier.
replicate that.
Yeah.
As long as you put like a good barrier, it
Yeah.
doesn't feel like, bizarre.
Exactly.
So you might wanna, that one might be a little, I don't know about that, but this one, all right, perfectly fine. I'm done with this. The only other thing I could do, did we get rid of the suction cups?
Now there's one.
I see a. So this seems to be a really stiff right here, all right? So we're gonna do a little extra right there. That's gonna pull it up. Can you feel it? Okay, so I'm gonna pull that down and I want you to bring your arm this way. Okay, can we do that again? All right, feel that? Okay, ready? So this is lifting it up and this is pulling it out. Wow,
There you go.
it was
That's
a
how
cup fart.
That's how that's supposed to work. Not me, everybody.
That's another lecture. What you do when somebody passes gas, which is even worse when it's you. Anyone want to fess up about how they handle gas? Go.
It's a really good sell for aromatherapy.
You better to just say something about it, be like, "Whoa, that's not the release you were looking for." And everybody can laugh, and you're over it. You've acknowledged the fart.
And you need to let people know that it can
I
be-
like the aromatherapy.
Yeah, that's good.
That's not lavender.
I ordered lavender. Can you feel the difference in
Yeah, that's much better. More.
the intensity? So that's just another example. All
I
right.
like those with the little handle on top.
Yeah, you know, you can use it. And
Yeah.
the other type of cup is plastic.
You need the. We don't have the gun.
I don't have it. It's all
I
right.
don't like
That's probably better. You always leave me with the boot.
Yeah, they're like this. This is actually the one I prefer to use.
The ones with the actual gun with the hose, you're gonna get much better suction on those. The silicone ones are a bit more user friendly, but they're never gonna have the intensity.
Did I bury my lotion in here
I
someplace?
have no idea.
But do you guys keep them on, like, do you?
No.
Oh, okay, 'cause I don't,
Yeah, you're moving the cup,
yeah,
alright, don't leave static cupping, static cups, that's where you get the marks. So, if you put a little lotion on this,
Do you notice like even in an isolated area, she applied some movement, took off. Applied somewhere nearby or adjacent, not the exact same spot. So just keep them moving, either on and off, or get the lotion on there and slip and slide.
that's how we
Just
have
flip
it.
it completely inside out.
Yeah, I did that, cause otherwise it makes a noise.
This, it gets better contact
Alright.
that way anyway.
This is a little slippery now. Alright, so I can slide this. So I've got the suction on there. Alright, and then I can say, alright, I'm gonna slide this way and you're gonna come back this way with this. And that's even more intense. People don't want pressure as much as they want intensity. They want something to feel like something is happening to them, and so they'll call it pressure. But if I were pressing hard on this, then there's not a lot of meat right here. Then I could actually bruise against the ribs or whatever. Whereas when I'm lifting up, I'm not gonna do that. Okay, child, lay on your back. Keep your knees up.
And I'm not the best example for the intensity with cupping because of the loose skin. Where you find areas of restriction, cupping, I tell you what, doesn't take a lot of suction, it's very intense. If there's scar tissue or some kind of densifying of the superficial fascia, you do not need nearly as much as you would think. It can, and the person will know, the denser the tissue, the more intense the sensation of the cupping is applied.
or if they're dehydrated.
Yeah. Now, the male gender, species. Do you see where I put this pillow? Done. Okay, don't need to worry about anything. Alright, we're going to undrape the chest area. So will you hold on to this towel? Alright, and I'm just gonna pull this down. Good. And I'm gonna fold this up.
So I can see it.
Alright, now what I've got is I'm gonna do some rolling of the abdomen. We talked about how the guts and stuff are important with that. And I'm gonna slide up using this side of my hand right to where I can get into the ribs. See that?
The only area you're trying to avoid is the solar plexus. You don't want to put too much pressure. So off the midline.
And I wanna hold the liver gently in my hand. I don't wanna come in like this and squeeze down or anything like that. I want a nice little cup right here. Let it slide down. Big breath in. And out. And I'm just gonna pull that down just a little bit. And again. And down. Usually you do things about 3 times. And again. And down. I'm gonna mobilize the ribs. Let's say he's got a spot here that's a little stiff. Go ahead and take a breath in. And blow it all out. So on the breast tissue is gonna slide under the arms or some facsimile of. So if I stay just below the clavicle, I'm not gonna run into that. So soft fist, I'll sometimes use a triangle like that. I will sometimes come in this way. You know, it just depends on the person's anatomy. Big breath in. Blow it all out. You should go. And again. Very good.
Yeah. Exactly. But you would hear it even with their nose breathing. Like she can, if you guys can't.
If they are very congested, if there's been a lot of coughing, a heaviness, then we can do something that will increase the exhalation. So it's a pressure in, breathe in, nice and flat pressure, not excessive, blow it all out. Follow it down. Hold it there, take another breath in. And blow it all out, hold it there. Take another breath in. And you pop off just as they're getting that breathing. What that does is changes the pressure gradient inside the chest wall. And they'll usually, he didn't snort, but lots of times they'll go
Pop off just as the inhale starts to increase. It's a way to suddenly create a pull in. Isn't that part of an old osteopathic?
That's what I was just gonna say.
Lymphatic fluid
yeah.
movement.
So the lymphatic approach is very similar. It's all the same things. You know, you're mobilizing the abdomen, you're pumping on the lower ribs, pumping here at the chest. People are thinking that lymphatic work is where you just kind of slide the skin like that. Not really, no. What it's more about encouraging the normal pumping action, which we'll get into more specifically, but it really happens at the abdomen, in the thorax, is where you really get the changes. So.
My aha in general a while ago was just using breath as a muscle entry technique.
Yeah, big breath.
Big breath for a lot of stuff. And by holding the ribs and the shoulders, by inhibiting the muscles of the ribs and shoulders, you naturally force the diaphragm to engage more effectively.
So that's getting this to lengthen out the upper trapezius and through here, especially if the arm is assisting. So I can go like this, reach for your feet. Same thing.